Kasama po natin ngayon sa studio si Dr. Lady Ruvy Tagulao. Isa po siyang Integrative Medicine and Homotoxicology Specialist. And of course, yun nga yung pag-uusapan natin ay Introduction to Homeopathy Medicine. Good morning again.
Good morning, Angela.
Okay, so ano nga po ba yung homeopathy medicine?
Well, homeopathy medicine, so you could classify that as under alternative and complementary medicine. So it's a natural way of healing. You use natural substances like, vitamins, minerals, and even animal products. So what is homeopathy? Homeopathy originated from Germany. Dumating na siya bansa natin, as I've said, mga 20 years ago. So, but in Germany, like over 100 years ago, nag-start na siya. So it uses the smallest amount of dose needed to treat or heal someone. So yun yung the smallest amount of dose. So they use dilution. So usually homeopaths are known as for the dilution remedies.
So when you say, diba, it's natural healing process of the body. So parang kung isipin mo, it would take time. Diba? Hindi siya katulad ng mga conventional medicine na automatic, like yung pain reliever in just 4 hours or in just ilang minutes, in 4 hours, wala ka nang mariramdaman na sakit. So this one, it would take time.
It would take time, but I've said, if you get the remedy right, actually homeopathy would be a gentle but speedy recovery. So the thing is, in medicine, there's a place for everything. So, I mean, if you had an accident or kung manganganak ka, you go to the emergency room. But kumbaga, ang mga patients namin in this homeopathy and homotoxicology, usually nakukuha namin yung mga chronic disease. Kasi usually kapag mga pasimple lang naman yan, they would go to the emergency room or the hospital. But usually mga patient namin yung madami ng maintenance medication or yung mga patient, kasi by choice naman, ayaw mag-chemo or ayaw mag-surgery. So we try to help them.
Okay. So yun nga, yun sa iyo pupunta, yun yung I was gonna ask that kung kailan pupunta sa isang homeopathic specialist, diba? Kasi yun nga, kung emergency naman, there's hospital naman. Pero pag mga maintenance, sa inyo na pupunta, pwede naman.
Yes.
O, kasi iba pagka may mga maintenance sila, ang nagkakaroon naman ng problema sa kanila, mga liver.
Side effects.
Because of the
Lalo pag 10, 20 years na dyan, mararamdaman na nila. But as if, mas maganda, di ba, sabi, prevention is better than cure. We do have patients na, our age, na nag-uumpisang, mas maganda talaga, I mean, prevention, preventative. Lalo na kung may family history, ayan, that would be a perfect opportunity.
So ano-ano po yung mga ginagawa dyan sa klase ng medicine na yan?
Okay.
Anong mga therapies?
Mga therapies. So, katulad nga nabanggit ni Kuya kanina, yung binabanggit niya na ini-injection sa tuhod, that would be biopuncture. So, we use the homeopathic remedy to certain parang acupuncture points, if you might say, to stimulate that organ or that meridian. So, may mga tablets, ampules, gels, creams, katulad ng Tromil.
But
It
how
is really
often
good.
do you do that?
How often? Now, it depends on the condition ng patient, ng tao. If you're doing it as a preventative, like for example, you're asking me earlier, if you want to do like a detox, sabihin natin, it depends again on, do you have a healthy lifestyle? I would ask all these questions trying to gauge on how much toxin load you have. So sometimes, sabi ko na lang, once or twice a year, magkaroon ng parang preventative maintenance ng detoxification. And then, kung may sakit ka naman, then I would at least give me, sabi ko nga if we're trying to do something, sabi ko, give me at least 1 month for a year na meron kang sakit. If you have, say, diabetes, cancer, or whatever, bigyan mo naman ako ng kahit paano certain time. I think that's fair enough. Yung iba kasi pupunta, gusto nila parang agad instant, right then, or kailan, parang nagbibigay ng duty, o kailan ako gagaling. I mean, it's not that. Again,
like what we've discussed na it takes time.
It takes time, and it all boils down to a proper diet, good diet, and a healthy lifestyle. Kasi even if, katulad ba nga ba yung patients ko, they're sick and then they can't stop smoking or they can't stop drinking, and sayang, di ba?
Or a question po, yung po bang chelation ay kasama sa homeopathy?
Hindi siya, no actually, it's not part of homeopathy, yes.
Iba siya.
Iba siya. So, chelation is used in many different ways. For example, in conventional medicine, from the word chele, you're supposed to chelate heavy metals. Kasi heavy metals, you cannot get rid of that in your body. It's very hard. Kasi they're big molecules, heavy molecules, and then they stay there in your fat cells. So for example, yung mga common like say mercury poisoning, mercury, lead. Now you cannot get rid of that in any other way. You need to use a chelator. Oo. That's
Pero
what-
you do that also, di ba?
We do that
Alternative
also. Yes,
therapy.
yes.
Aside from chelation, what else do you do?
Ako to din binagit ni Kuya yung sinasabi, yung kinukuha siya ng dugo, tapos binabalik sa kanya. So, sir, nilagyan ba kayo ng parang ozone?
Oo,
Yes, oo.
Merong parang
Yes.
meron siyang parang tawag doon yung machine na parang
Machine.
ginagamit din sa dumadaan doon yung blood mo pag inalis.
Okay.
Parang nilalagyan ng ozone,
Ozone,
yata.
okay, oo.
Tapos ewan ko anong tawag doon eh. Para siyang ang process niya para kang dinadialysis.
Parang dialysis. So, ang purpose lang dun is to introduce the ozone in your blood to make it, kasi yung blood na yun is unoxygenated blood. Di ba po kapag sinaksak na yung ozonated yung air, nagiging parang bright red na siya. So, tapos ibabalik na sa'yo. So, it has so many purpose. Like for example, for patients na may infection, it can help. And kapag medyo low ang oxygen, mga certain diseases na very low oxygen, it can help oxygenate your body. So, there's so many,
So, hindi naman necessary, kasi wala naman akong sakit eh.
Yes.
But not necessarily kailangan may sakit para i-practice yun, di ba?
Yes, opo. Lalo na po dito kayo nasa taga Metro Manila or even for me in Zambales, we're all exposed to toxins and pollutions every day. Or kumakain tayo, hindi naman everyday organic yung kinakain natin. So, naiipon yan sa katawan natin.
So, you also do that, yung pong gano'n. Anong
Yes.
tawag po sa process na yun?
Yung specific one sabi niya, that is IV ozone therapy.
Oo.
Or yung sinasabi mo ini-inject sa'yo, that is autosanguine. At that is homeopathy naman.
Oo.
So we all do that at the
Kasi
clinic.
lahat, pati yung mga iba-ibang klase ng
Yes,
vitamin.
it has to be a holistic approach po.
So, yung mga vitamins na, vitamin
Yes,
drip.
Vitamin drips, napaka-importante din.
Ano yan? Paano nyo i-compare po yung vitamin drip dun sa tinitake orally?
Oral, oo. Kasi usually, okay, oral, it depends anong gamot ba yan. There are some vitamins na ang tagal bago matunaw. Or iba naman, may mga certain people, mahina ang digestion. Or worse, mahina ang absorption. And therefore, you cannot absorb it. Like for example, even if in antibiotics or even medicine, if it's 500 milligram ba, aabot dyan sa tamang pupuntahan? Usually, hindi na. So the thing is, with certain diseases, or as a preventative, like for example, yung mga gulay or mga prutas, sometimes, kung hindi organic, minsan mas lower yung mga, especially the mineral content, So, mas maganda kung IV, intravenous, sa ugat po nilalagay. So, diretso, kumbaga na yung absorption.
Oo. So, mas, like, halimbawa, yung mga vitamin C.
Yes.
Kasi merong, nagpapasaksak. Sino ba yung nagpapasaksak ulit ng vitamin C?
Ako.
Di ba? Yung mga ganon, mas maganda siya kesa sa magte-take ka orally.
Yes, opo.
Pero how often ba yun dapat? Kasi di ba yung vitamin C,
Every day.
everyday nagte-take ka,
Yes.
no? Tapos yun namang ganon na parang araw-araw ka nag-a-addict ka ng ganon.
Ay, hindi naman
Hindi
po.
naman.
Minsan, sino ba naman may gustong tinutusok everyday?
Oo nga
Oo nga,
Oo.
masa.
And it takes time. It takes time. Hindi po pwedeng yung 500 ml o 250 ml tapos natin in 10 minutes, no? So, we need to sit down, no? At least an hour and a half or depende kapag kung anong blood pressure ng patient, sometimes 2 hours or pag chelation, 3 hours. So, it depends. So, ito po isang process na hindi po minamadali. So, kung ikaw yung tipong masyadong busy, isa-schedule mo yan on a day na talagang rest day mo. For preventative, maybe weekly or twice a week or yung mga ibang patients na kapag after doing it regularly, maintenance na lang nila once a month, twice a month. O yung mga iba naman na nagbibiyahe, gusto nila healthy sila bago sila mag-fly. Oo. Or pag uwi, mga balikbayan, ayaw nila magkasakit. So, mag-vitamin din na yan. Or yung mga pagod, or very bad diet, or marami after holidays, actually, maraming treat.
Meron din dyan yung mga pantunaw ng mga kinain na taba-taba.
Ang tunaw ng pagkain sa tinataba.
Oo.
I can help you try to excrete all the toxins that came with that diet you had.
Kasi si Rina, mataba eh. medyo mahirap tong na yan eh. So, ano ba mahal ba?
It depends, as I've said. Now, mas mura kapag as a prevention. Mas mura talaga. Kasi kapag medyo may sakit ka na, kumbaga may high blood ka, may diabetes, may cancer pa, it adds up. Mas matagal din yung
Healing
treatment. Oo.
Pagka meron ng
Mga
high blood.
high blood,
blood,
diabetes.
Sandali mo na lang gagamutin yung doktora pag ang dami ng sakit. High blood, may, di ba, diabetes. Sandali na lang yun. Oo. Serbisyo funeral na.
Wala. Pero Doc, gusto ko lang din itanong, pwede din ba to sa mga bata?
Yes, oo, pwede. Yung mga IV siguro,
Kasi
hindi
di ba may
masyado.
mga bata na mababang immune system?
Ay, oo.
Tapos yung iba may mga, yung parang meron silang mga leukemia, yung mga
Leukemia, or even yung mga may asthma, may mga allergies.
Ayun, Diego,
Or very
allergies.
Good
Pwede
ang
sa allergies.
homeopathy, oo.
Kaso sa injection allergic.
Hindi, si Angel yung nagwawala.
Hindi Ayan, Doc.
Si Reg.
Saan po kanila kayo pwedeng makontakt just in case they want to try this Homeopathy Medicine?
Yes. Also, here, I'm here in Manila every week, Tuesdays and Wednesdays, at the Biological Health Center in Malate. Likod po kami ng St. Paul's University. And we also have a branch in Alabang. Actually, yung andun is in sa Westgate Tower Investment Drive, Magical Business Park. But we also have partner clinics in Cagayan de Oro, Cebu, Davao,
Wow.
Surigao, Dipolog. And for me, I am in Zambales and Subic and Olongapo. That's where I'm
all
based.
over the world.
Yes, so we have it here.
Alright.
So hindi niyo po kailangan pumunta abroad because this is from Germany.
nga eh.
So we use all imported German
From
products. Yes.
Okay. Maraming salamat po sa inyo, Dr. Lady Ruvy Tagulao. Isa po siyang Integrative Medicine and Homotoxicology Specialist.